Hello there. My name is Helaine Ortmann, and I'm a longtime enthusiastic volunteer with the Bright Run, and I just happen to be a breast cancer survivor myself. We're so pleased to have Dr. Elysia Donovan with us today. Welcome.
Thank you for having me. I'm very excited to be here.
Dr. Donovan, if you feel comfortable, could you share, do you have any personal connections with breast cancer, other, of course, than the professional engagement you have?
Yes, unfortunately, like many people, we know I have some close family friends as well as personal friends that have been affected by breast cancer.
And I know that you've been out to the Bright Run many times. Is that true?
I've been out to the Bright Run pretty much every year, and I usually bring my whole family with me.
That's fantastic. So you, of course, know we're coming up to our 19th annual Bright Run this September 12th.
Yes, very excited. Already been in the calendar.
That's great. That's great. Tell me, what is your job at the Juravinski Cancer Centre? What do you do?
So I am a radiation oncologist. So I work with patients that are affected by both breast cancer and also patients that have gynecologic cancers. And I'm also a researcher. So I spend some of my time doing research, which is mainly focused on breast cancer.
How long have you been at the JCC?
I did my residency at the JCC starting in 2012. I then did my fellowship and a master's at the JCC in 2017, which finished in 2019. I then went to Toronto to work for a couple of years at Sunnybrook Odette Cancer Centre, and then I came back to the Juravinski in 2021.
Now, I'm a shameless fan of the Juravinski Cancer Centre, so I'm totally biased. And I just think the world of the place, the care we offer, and of course our staff. What's special about the JCC for you?
That's a great question. I think first and foremost, it would have to be the people. Having worked in a few different places, we definitely have a very special patient population in Hamilton and the surrounding areas and at the Juravinski. I think there's also a really special component of the staff that work there. So all of my colleagues, all of our allied health workers, all of the volunteers that we have, just everybody that contributes giving our patients great care, I think is very much dedicated to our patients, to providing great care, and makes it a real pleasure to work with everybody.
hmm What would you say is the best part of your day?
Definitely the patient interactions and patient encounters. It's so nice to be able to have a conversation with a patient and trying to make a difference in somebody's life when, we choose to be there, the patients don't choose to be. So being able to try and make their day a little bit better when they have to be coming in to see us, I think is a really big highlight for me.
hmm You mentioned a few minutes ago that you're a researcher. And of course, you have your research has been funded through Bright Run dollars. 24 research projects have been funded to date by Bright Run dollars since 2008. And people can take a look at any and all of those projects on our website at brightrun.ca. Could you give us a summary in plain English about your research, what it is, and why it's so important?
Yeah, so I actually am involved in two projects that have been funded by the Bright Run amazingly. One of them is a study that's looking at delivering high dose radiation in patients that have breast cancer that has spread outside of the breast and the lymph nodes to different areas. We're looking at doing high dose radiation when they have progression of some of their tumors on their current drug treatment and seeing whether that high dose radiation can allow them to stay on the treatment that they're tolerating and is working elsewhere in the body for a longer period of time by targeting those few spots that are progressing with radiation. This is called oligopregression, and it's being looked at in a lot of different types of cancer in a lot of different places now. And so that's one of the studies that I'm really excited about and think there's an opportunity to make a huge difference by seeing if radiation in the setting of oligopregression works to basically extend the time on the patient's currently otherwise effective and tolerated drug treatment. The second project that I'm involved in with Dr. Tim Whalen is a project that's looking at currently patients that have certain, let's say, high risk features of the tumor in their breast after it's removed. They get radiation for a week to the whole breast in a number of cases, and then we add an additional 4 or 5 boost treatments onto the end just to treat the area that the tumors was removed from because of those high risk features. So we're looking at, instead of giving the treatment over 2 weeks, can we give it over one week and add the boost in at the same time that we're doing the radiation to the whole breast. This is called simultaneous integrated boost. And it's been tested in other patients in the past where we were using 25 treatments or 15 treatments. But now that recent studies have shown us that we can give breast cancer radiation in just 5 treatments plus the boost, we want to see if we can do it together. The advantage of this would be potentially reduced acute toxicities like skin reaction, breast discomfort, potentially improved long-term outcomes, so better cosmetic outcomes, less long-term side effects, as well as, of course, patient convenience, only coming 1 week instead of 2 weeks. And for some patients, that can make a huge difference financially in terms of finding childcare, missing work, getting transportation to and from the cancer center. So for all those reasons, we really believe that shortening the treatment from 2 weeks to 1 week could really make a big difference in this setting. So that's the second project that I'm working on.
That's great. Over the years, can you give us a sense of the kinds of changes, improvements you've seen in particularly radiation treatment?
We've seen incredible improvements over the past 15, 20 years. And I think the biggest thing that I want to highlight is the ability to personalize and tailor medicine for a patient's individual characteristics and risk factors of their particular breast cancer. 20, 25 years ago, we were doing 5 weeks of radiation. And since then, it's been shortened to 3 weeks and then shortened to 1 week. So obviously, of course, for many breast cancer patients, that's much more convenient and feasible. But talking about personalizing medicine, we also know now much more about patients that need, let's say, their lymph nodes radiated versus those patients that won't benefit from lymph node radiation. Adding an extra boost of radiation for those patients that have high risk features and really need that extra reduction in their risk of local recurrence. We also know that there's some patients that may not need radiation and we can just observe them on surveillance closely and not need to put them through radiation. There's also been a lot of improvements, of course, in systemic therapies and in genetic gene assays that can test whether patients need chemotherapies or drug therapies or not. So, of course, every person's story is a little bit different. And so some of the things that I just mentioned may not apply to all patients. But really, I think the key is that we much better have the ability to look at a person's individual story, individual cancer, and tailor the treatments that they need to minimize their particular risk without overtreating them much better than we could before.
For those of us with breast cancer, what a great time to live in, because of the advances we see that are coming so quickly, whether they're in the equipment itself, in the expertise of the people who are caring for us, and these advances in things like radiation, chemotherapy. What do you see on the horizon? Anything on the immediate horizon?
That's a great question. Of course, there's a lot of, drugs, systemic treatments that are undergoing testing as we speak. And we've seen a lot of improvements already in the past few years in the ability to target different receptors and different molecular markers. And certainly, I think there'll probably more of those coming down the pipe in the years to come. For radiation, I think we're also learning a lot about a situation where patient has chemotherapy prior to going to surgery. We've also really developed, a lot more knowledge in terms of what patients benefit from extra treatment versus what patients may be able to hold back on some treatment based on their response to what we call neoadjuvant chemotherapy or chemotherapy before surgery. And there's a lot of studies going on this right now. And I think that once we have the final results for those studies, we'll really be able to tailor our treatments even better for our patients.
What was it that got you into this field, Dr. Donovan? Is that what a child thinks about, becoming a radiation oncologist?
I think I sort of ended up here, to just a few turns along the way. But I think for me, when I was going through medical school, when I did my oncology rotation, I just found the patient connection very special and very meaningful. And so really it was the patients that got me into this. And then I think that just the research aspect and being able to move care forward was maybe something that became very interesting to me in terms of radiation oncology specifically.
Mm-hmm. So as I mentioned, I'm a breast cancer survivor myself, and I had 2 weeks of radiation. On balance, the experience was a very positive one, but I'll admit to being very apprehensive, thinking about it, sort of like a science fiction kind of thing, very bizarre to go into the bunker and get radiation. To someone who is needing to have it, who's contemplating it, what might you say to encourage them?
I always tell patients who need to have radiation that I know it sounds incredibly scary and maybe even looks a little bit sci-fi when you see the machine for the first time. But really having radiation feels like getting an X-ray every day, especially for breast cancer. That's essentially what it is. It's like a high dose X-ray. And I think that, all of our team members downstairs on the treatment floor, radiation therapists work incredibly hard to make sure that the patients have a good experience. And I would say almost universally, every patient that comes through my clinic while they're getting radiation tells me how friendly, how comforting, how knowledgeable, and how safe the staff made them feel that are on the treatment floor. I've never heard a bad thing about them. And so I think that it really makes patients experience much better just working with the radiation therapy team. And most patients really tell me they don't find it as bad as they were, a little bit worried about it being.
Hmm. If you had an overarching message to give to people with breast cancer, what might it be? What might you say to them?
That's a great question. I think maybe one message for everybody, maybe, a little bit challenging because every person's story with breast cancer is so different. But I think maybe I would go back to the statement that, right now, if you have to have a breast cancer and go through it, it is a time where we really are able to better characterize someone's risk of the cancer growing, of the cancer coming back, and provide the best treatments that we've ever had. We've had a lot of advances in breast cancer. And so I think that just feeling that ability to discuss your options with your team of oncologists, your nurses, your support team, knowing the options that are available to you, and just asking any questions you may have, just to make sure that you're getting the all of your questions answered, and knowing that there's a lot of treatment advances that weren't available many years ago to improve outcomes.
Hmm. So, thinking ahead to the happy event coming up September 12th, which is the Bright Run, and it's going to be our 19th annual, the amazing work that participants do, the teams, the team captains, our community partners who contribute dollars to help fund all of the behind the scenes kinds of equipment and all of that, knowing that all of the dollars raised are going to support breast cancer research locally, what might you say to encourage people to be involved in the Bright Run?
Well, first of all, it's an incredible event. It's so much fun every year. There's so much to do there, so many people out, and it's a beautiful setting. So, coming out for the run, being part of such a huge movement that makes such a big difference is one great reason to come out. The second thing is, a lot of the huge breast cancer trials that have been done in Canada and across the world have actually started with our researchers at the JCC. And so really, the way to start a huge trial is often by getting a small pilot study going to prove that you need to do the bigger trial. And so I think it really goes to show you that all the research funding that's done has the ability to make such a huge difference, and already has. And so, if you're thinking that, you're the fundraising that you do, the impact that you make, you're not sure how big of a difference it makes, I can assure you that it really does.
What a great way to end the conversation, Dr. Donovan. It lets everybody know how valued they are and how important their contribution is. And that's regardless of, the fundraising achievement they do. Every dollar matters in this case, right? Contributing to what is really essential. And not only for those of us locally, but as you've mentioned, internationally. So it's wonderfully inspiring to hear. And how do you feel as a radiation oncologist when you're out at the Bright Run and you rub shoulders with maybe patients and families that you know? What's that like for you?
Yeah, I always find it incredible if I run into one of my patients at the Bright Run. It's so great seeing them in that environment where everybody's so excited and it's so positive. And, many of them have sort of come through the treatment and now they're on the other side, or sometimes even in the middle of treatment. And it's just so clear to see the energy that patients and their families get from being at the run. It's a pretty amazing experience.
Absolutely. And then we're partners together.
Hmm.
Hmm. Thank you so very much for your time. It's been absolutely wonderful to speak with you and to learn about your specific funded projects and your involvement with the Bright Run. We'll see you in September.
Looking forward to it. We'll see you there.